Systemic lupus erythematosus, more commonly referred to as lupus, is a serious and chronic autoimmune illness that can affect many organs in the body with an unpredictable course. This complicated disease impacts 9 times more women than men, often in the prime of their lives. Rowena Rodriguez was just 19 years old when she was diagnosed with lupus.
It was the summer before I was supposed to go to university. I noticed that summer I started having really high fevers, and I was having really bad joint pain. And during Frosh Week, my body just basically broke down. It was the hardest time, I think, of my life.
The immune system of a lupus patient mistakes certain normal tissue as foreign tissue and attacks it, leading to inflammation, which is the body's normal response to injury or infection. Commonly referred to as the disease of 1,000 faces, the symptoms of lupus vary greatly from person to person, making the disease difficult to diagnose and even more challenging to treat. Dr. Murray Urowitz, Toronto-based rheumatologist, explains.
Well, the treatments currently used for lupus patients weren't originally developed for lupus. They were adopted from other illnesses, and they include drugs like the nonsteroidal anti-inflammatory drugs, the cortisone drugs, and the immunosuppressive drugs. Overall, these drugs are very helpful in a significant percent of patients, but we also have a residual significant number of patients who don't respond to these medications, or who respond but have unacceptable side effects and cannot continue the medications. And that group of patients is our problem.
A new therapy called Benlysta has been authorized in Canada. It's the first drug specifically designed for the treatment of lupus in almost 50 years. Benlysta is indicated for use in addition to standard therapy for reducing disease activity in adult patients with active autoantibody-positive lupus. The safety and efficacy of Benlysta have not been evaluated in patients with severe active lupus nephritis or severe active central nervous system lupus. The efficacy of Benlysta in patients of Black African heritage has not been clearly established.
Well, the currently used therapies for lupus, the cortisone drugs and the immunosuppressive drugs, work by dampening down the entire immune system. Benlysta is much more targeted. It affects a protein which affects the cells that produce the antibodies that are probably the cause of lupus. And so targeting that specific part of the immune system is what makes Benlysta unique.
Benlysta is a human monoclonal antibody and the first in a new class of drugs called BLyS inhibitors that specifically binds to and inhibits the biological activity of soluble BLyS, the B lymphocyte stimulator.
I don't ever feel like because I have lupus I can't do something, but then there are days when it tells me, it speaks to me, and it says, no, you're not going to do that today. And those are the hardest days.
For more information on lupus, visit www.lupuscanada.org.